Good, af- good afternoon, everyone. Thank you for joining us today. We'll get started in just a moment, but thank you for joining us for our latest webinar presentation. Welcome to all of you. Thank you for joining us today for our final installment of our series, Planning for Care, Choosing the Right Long-Term Care Facility for Your Loved One. My name is Amira Bilal. I serve as Vice President of Programs and Policy for Caregiver Action Network, and I'm very pleased to be with you today. Caregiver Action Network is the nation's largest family caregiver organization. We work to improve the quality of life for tens of millions of family caregivers. These Americans care for loved ones with chronic conditions, disabilities, or diseases. We also support those meeting the living needs of older adults. CAN serves a broad spectrum of family caregivers. This includes parents of children with significant health needs. It also includes families and friends of wounded soldiers, from a young couple dealing with a diagnosis of MS to adult children caring for parents with Alzheimer's disease. We are a nonprofit organization providing education, peer support, and resources to family caregivers across the country free of charge. The format of today's webinar will be a moderated presentation and discussion showcasing the expertise of our speaker. You might be asking yourself, why this topic? We know that choosing a nursing home or a facility for a loved one can feel overwhelming and emotional. This session will provide caregivers with practical, high-level guidance on how to evaluate long-term care options, understand key differences between care settings, and identify important factors that impact the quality of care. Caregivers will learn what to look for before admission, how to advocate for their loved one after placement, and where to find trusted resources for support. The goal of this session is to empower families with foundational knowledge so that they can make informed decisions with greater confidence. At this time, we will be posing a poll question to the audience. Please feel free to answer the question. We would just like to know who's in our audience and just get a snapshot of your experience. While you're doing that, I'm excited to introduce our speaker for today. Jeff Aproof is the founding attorney at Bedsore Law, where he has dedicated his career to fighting for elderly and dependent adults harmed by nursing neglect and holding care facilities accountable. A nationally recognized top 10 nursing home trial lawyer, he is equally passionate about empowering caregivers and families with the knowledge they need to prevent harm before it happens. At this time, I'll be turning it over to Jeff. Thank you so much for joining us today.
Thank you, Amira. I appreciate the warm welcome. And welcome, everyone. Thank you so much for being here today. My name is Jeff Aproof. As Amira said, I'm the managing attorney with Bedsore Law. We represent individuals against healthcare facilities for pressure injuries and other harm. I want to acknowledge that this is a very hard subject for a lot of folks. I have a personal connection to this. I've cared for my mother who passed from cancer and cared for my uncle who recently passed and was in multiple facilities over a number of months. And it can take an emotional toll on the family, as we all know. I want to set some expectations for the presentation today. I am not here to give legal advice. This is for practical guidance. I want you to leave today with a framework and a tool set to apply when you're potentially choosing whether to select a facility for your loved one. We'll save some time at the end for some questions, and feel free to drop them in the chat as we go along. Okay? Next slide, please. So let's start with what we've heard from caregivers ourselves. Caregiving is one of the hardest jobs in the world, and almost no one chooses it, let alone on a calm day, right? When we're in this situation with our loved ones, there's a lot of pressure. There's a lot of emotional weight. And when we get to the point where we need to choose a home for them, it can create a lot of grief, a lot of guilt, exhaustion, and most importantly, what I see in my practice is the pressure on families to really get it right. Nobody wants to put their loved one in a facility that causes them harm. And so hopefully today you'll take away some tools that will help reduce the chances that that happens. Know that you're not alone, right? There's more than 53 million family caregivers around the country. As the age or population continues to age, that number will continue to increase. And most people walk into this decision without a roadmap and without any resources. So hopefully today you get a clear and manageable framework, but no, you do not have to become an expert overnight. A lot of times I tell people just go with your intuition and your gut with a lot of these things. And that's a good guidance for you, along with what we're going to share with you today. So next slide, please. So let's start at the beginning. What are the actual type of care facilities that are available? There's a lot of jargon in this world, so let's try to keep it simple. There are basically 4 types of settings for our loved ones. The lowest level of care is considered an assisted living facility. In some states, they're called residential care facilities for the elderly, or RCFEs. Those are going to be for folks that are semi-independent, can still get around, but may need a little bit of help with some of their more daily activities of living. Maybe they need help with some of their meds. Maybe they need help with some of their meals. So that's going to be a lower level of independent care. A nursing home or nursing facility is 24-hour skilled nursing. It's the highest level of non-hospital care that's available. And that's for folks that sometimes are on vents, sometimes have really high levels of care that's needed, and a bunch of what we call comorbidities. And then there's the rehab center. The rehab center is designed for a short-term stay and usually treats folks who are recovering from either a stroke or a surgery. And the goal is to return home. Okay. And then there's a memory care facility. These are designed to protect individuals with Alzheimer's or dementia or other mental incapacities. They're usually secure facilities and are designed to keep people inside the building to prevent what we called elopement or escaping the facility. These facilities sometimes overlap each other too. So sometimes you can have an assisted living facility also within a nursing home. So it's important to understand what type of care the facility you're evaluating provides. Next slide, please. Now, the biggest question for families is whether their loved one needs a nursing home or assisted living facility or a care center, and when. Okay. There are generally 6 signs that we hear about in our practice from families who realize that home care is no longer enough. Generally, it has to do with their medical needs, sometimes complex medications or wound care. Safety concerns start to appear. They may start losing their gait. They might suffer from some falls. Maybe they become forgetful, start leaving the stove on. Personal care may become an issue. Their hygiene may suffer. They might have trouble transferring from the bathroom or a bathtub. And then repeat hospitalizations are also a big flag. So folks that are, having multiple admissions to the ER in a month can trigger the need for a higher level of care. And then that can also turn into recommendations from physicians or the treaters at the ER to recommend a higher level of care. And then sometimes there's unfortunately burnout with us, with the folks that are there providing the care. Life goes on as we care for our loved ones. We have to continue to put food on the table and provide for our other family members. And this can not only cause a great deal of grief and emotional harm, but it can cause burnout. And so that is not good for our loved ones, right? If we're getting burnt out and can't provide the care that they need, we do need to find a higher level of care for them. And I want to leave this section with this. That's not a failure on your part, right? So many things in life are out of our control. This is one of the biggest ones. So try not to get down on yourselves if you feel like you do need to find a higher level of care. We see this in our practice every day. It takes a pretty big emotional toll. And just know that you're doing the best thing that you can for your loved one. Next slide, please. Okay, so you've made the decision to find a home. What do you actually do when you walk in the door? I say this to everybody, you have to tour in person whenever you can, okay? If it's at all possible, tour in person. I know sometimes that's difficult if we have loved ones that live in different states, or you just can't go. But the best thing is to trust your eyes, ears, and your nose. We have some things on the column here to look out for. I think we're one slide ahead. There we go. Thank you so much. So on the left column, we have some things to look out for. Okay, these are things that when you go into the building, things that you can see and most importantly, smell. So the first thing that I say is, how does the place smell? And I'm not talking about disinfectant smell. I'm talking about other smells. And also look for residents. What type of activity are you seeing in the facility? Is everybody bedbound? Because that's not a good sign. Look to see if there's activity, if people are engaged, if there are people in the activities rooms. That's a really important sign that the residents are not being provided drugs to keep them in bed. On the right column, we have what to ask for, okay? Some of the most important things to ask the staff are staff to resident ratios, okay? How many staff do they have to each resident per day, per shift? You'll also want to know about staff turnover. How often are staff leaving? And are they using traveling nurses? Okay, that's a big thing. When they have people that are coming and going in the facility, we've seen that usually results in a worse outcome for our loved ones. Okay, and then ask them about fall and bedsore preventions. What are their protocols to prevent those very preventable injuries from occurring? And then ask them to see the survey, state survey on the spot. Okay, ask them to see it on the spot. Check to see if they hesitate showing it to you. Facilities that have their stuff together will not hesitate and will be proud to show you their state surveys because they'll show that they are providing for their residents and providing the care that's required. Okay. And always bring a piece of paper and a notebook or a notebook and pen so that you can take notes. There's a lot to absorb when you walk into one of these places, and it's going to be a lot to remember when you leave, especially if you're visiting multiple facilities. Okay, thank you. And next slide, please. Okay, now we're here at the Medicare Care Compare. Here's the tool most families have never heard of, and it's free. So if you remember nothing else from today, remember this one, medicare.gov/care dash compare. It's free, it's public, and it's updated quarterly. Okay, and this is where you can see the overall ratings, the staffing levels, any inspection results, if they have any history of violations, those will be listed there, any penalties, and you should also be able to see the turnover with the staff there. Okay, again, medicare.gov/care-compare. Okay, and remember that low staffing ratings often correlate with lower outcomes for your loved one and worse outcomes and a higher risk for neglect. Okay, that's the biggest single factor when it comes to making sure your loved one is provided with the proper care. They need to have enough hands in the building. Next slide, please. So let me show you exactly how to use it. Okay, 4 clicks, that's it. Anyone can do this from a phone or laptop. So you're going to go to the site. You're going to select nursing homes. You're going to enter the city or zip code and then click on the name of the facility. Very simple. Okay. And then you want to compare facilities by looking at them side by side. Okay. And look at the staffing stars. Now, some of this information, well, all of this information is self-reported, okay, so by the facilities, but they do inspections to confirm that this stuff is accurate. So look at the inspection results, look at the staffing stars that they provide the facility, and that's going to be based on the data that they share with Medicare. This is really important stuff. Don't rush this. This is your due diligence that you need to do in addition to visiting the facilities. Okay, take the time to read these. In California, for instance, and in other states, you will see what's called statement of deficiencies that are sometimes included under these facilities. They will list things that have happened or occurred and things they've done wrong and whether they've been cited. You can get a lot of insight from reading those. You can see how what type of issues the facility is dealing with and how they're responding to them. There are interviews included in those documents with staff and the directors of nursing. And so it's a really important tool for you to use to ensure that the facility you're bringing your loved one to is going to be as safe as you can possibly make it. Okay. Next slide, please. So you've toured, you've now compared, your loved one is in. Now what, right? Your job doesn't end here, it just shifts, okay? Now you go from caregiver to advocate, okay? And now it's going to be your job to make sure your loved one is getting the care that they deserve, okay? So one of the things that I always tell people is know the residents' rights. You can do a Google search, nursing residents' rights. They're going to differ between states, but there are some federal rights that apply. Basically, it guarantees dignity, privacy, freedom from abuse, freedom from retaliation when raising concerns, okay? And then I also tell people to build a communication plan with the facility. Get a primary contact, attend the care plan meetings as often as they occur or as you can. Make sure you have an online communication with facility staff and visit often. Vary your times when you do visit. Don't show up at the same time every single day. And that's important because you want to see how they're operating throughout the shift, throughout the day. If you're allowed to visit at night, go at night sometimes to see how the night staff is providing care. But the families that I see in our practice with the best outcomes are the ones who never stopped showing up. And I can speak from personal experience. You can go from one unit and get great care, transferred to another unit right down the hall or on another floor and get completely different care. And so it's critically important for you to make sure you're there and observing what's going on and always ask questions and always document everything. So if you have an important conversation with the nurse about a pressure injury or about something that's not being done, take notes, okay? Take notes. If they allow you to take photographs and there's injuries or there's hygiene issues, take photos. Next slide, please. Okay, now, here's what to watch for when you do show up, okay? And what I tell people, and I said this kind of at the beginning, is trust your intuition. If something feels wrong, it usually is. Here's what to look for, okay? Look for physical problems. I always talk about bed sores, of course, but also look for poor hygiene. Are they suffering from multiple or repeated UTIs? That's a big one. Repeated UTIs is a big sign of neglect. Look for behavioral issues. Have they withdrawn? Are they becoming more agitated? Are they scared when staff members come in the room? And then think about the operational situation there. Is there enough staff? Are they mixing up meds? Are they giving you straight stories? I had an experience where we noticed a pressure injury on my loved one. It was a stage 1, and he was transferred to another part of the facility. And the nurse tried to convince me that that wasn't there. I had a photo of it. I had it documented. And we got him out of that facility the next day. So always trust your gut, always ask questions, and don't just trust what they're telling you. If something feels off, it usually is. And then remember, write it down. Okay. If you don't write it down, you won't remember the details that may become important later when you're advocating at a higher level for your loved one. Okay, next slide, please. And finally, the lifelines. Okay, so save this slide, or we do have a resources PDF sheet that we are providing that can provide you with the different phone numbers and hotlines that you can reach for your state. So you can download that. But basically, the key things to take away are there's a long-term care ombudsman in these facilities. Okay, it's a free advocate. They are there to advocate for the rights of nursing residents and sometimes residents in other facilities. There's also the Medicare Care Compare that we talked about, the tool from earlier. That's a really important thing to go through. And your state's complaint hotline, which should be listed in the PDF. Every state has one. In California, you also have the California Department of Public Health that has an online complaint filing system. Most states do have an online complaint filing system that you can use. My firm, Bedsore Law, we provide free confidential consultations if something harmful has occurred. And then there's also your representatives, right? Your state, your local, the people that you voted in Congress, or the people that are representing you in Congress. Sometimes they can get involved as well. And there's also regional centers that you can access that can help with some of this stuff. And with that, I want to make sure we have time for your questions. So the next slide.
Thank you so much, Jeff, for your presentation. We greatly appreciate it. The slide previous to this one that says question and answers was actually the making sure that our participants will have your website as well as how to contact you on social media. So we wanted to make sure that we did connect you directly with the audience.
Right.
And now we will take questions from Q&A. If you have placed a question into the Q&A, or if you have placed one in the chat, Nicole, can you give us any of the questions that you might have received in the Q&A?
Absolutely. We did have some questions come in, and I am very happy to share them. One of the questions that came through is, will the facilities also have options for assisted living, etc., or is it only nursing homes?
Great question. It depends on the facility. So check to see, because some facilities will have multiple levels of care within them. Even some acute care facilities, hospitals, will have a skilled nursing facility within the hospital or on a separate floor. And some skilled nursing facilities do also have an assisted living section or part of that facility that will be separate and distinct from the skilled nursing facility. They are regulated differently. So there will have to be separation, but they can sometimes be in the same facility.
Thank you so much. Another question that has come through is, and I think this goes back to what you were speaking about in terms of Medicare Care Compare. was it also mentioned that an external party goes in to review these facilities? Or how do we know to trust that particular tool?
That's a great question. And yes, so what they're called surveyors, and surveyors um, investigate and audit these facilities on a regular basis, and they also investigate them in response to specific complaints. And so the document that I was referring to, called a statement of deficiency, that document actually sets forth the findings of those investigations. And so you can see, and they're investigations that are surprise investigations, basically surprise surveys. So they'll show up without notice. They will interview folks in the facility. They'll interview residents. They will look at their medical records. They will interview staff at the facility, and they will pretty much do a complete look to see if the complaint that they've received is substantiated, or if it's a scheduled or regular investigation or visit, whether they're complying with the federal and state regulations they're required to.
Right. And there was a question that came through on the chat that I think connects with this as well. And so I'll just skip over there and ask, are group homes surveyed in kind of a similar uh, capacity?
Not to my knowledge. They're not regulated the same way. At least in California, those are regulated under the Department of Social Services, similar to RCFEs or assisted living, but they have different regulations, and they are not regulated the same way as nursing facilities are. So, and I just want to make a clear disclaimer. I don't pursue cases against those homes, so I don't have a whole lot of information about them, other than I do know they are regulated and investigated differently.
Okay, thank you. Are there websites to find out information on private facilities or the facilities that don't accept Medicare?
That's a great question. There is not one central site that I am aware of. However, if you do just typical research, and you call the facilities and you schedule a time to talk with them, or you do an interview with them, they will tell you whether they are Medicare facilities or not. And I will say you will also know whether it's a Medicare facility, generally based on the cost. So non-Medicare facilities, non-Medicare and Medicaid facilities are considerably more expensive.
Thank you. Another question that came in is about services that someone can receive in the assisted living facility or memory care center. What recommendations would you provide for residents to receive things like additional physical therapy if they're not offered by that facility?
This is a big issue, especially in skilled nursing facilities. It's a great question. So rehab centers, one of the facilities that I talked about, they are designed to provide a high level of physical and occupational therapy, so that their patients can get back into the real world and back home and independent. My experience has been skilled nursing facilities are less aggressive in their physical and occupational therapy. This is where the advocacy comes in. Okay. You have to be there to make sure they're doing it. It's really, really important to stay on top of it. If they know that their loved ones are involved and are showing up and advocating for them, they have a higher likelihood that they're going to perform the duties they need to do. If they know that no family members are coming by, or they come by sporadically, sometimes they'll decide not to do it. And a lot of times they will say it's because the patient refused it or the resident refused it. So it's really important that they know that your loved one needs the therapy to get better, and that's why they're there, a big reason why they're there. But it is a problem. It is not provided to the levels that they need to be provided in these facilities. And even when you advocate, sometimes it's not provided. Can you bring in a third party? Generally, no. Okay, these facilities usually won't even let you use your own doctor. They have their own everything. They have their own pharmacies. They have their own physicians. They have their own everything. And you're not allowed to use anything of your own. So if you are concerned about the number of therapists they have and the level of therapy that your loved one is receiving, then you may want to consider a different home.
Thank you.
Thank you so much, Jeff, for those answers. I just want to jump in really quickly and just acknowledge some of the comments and questions that we're receiving in the chat. Just want to let everybody know that this webinar is being recorded and that the recording, as well as some of the resources, including the state-by-state advocacy guide, will be available on that webinar's landing page. So we're putting the link in the chat so that you'll be able to access this information later. We know it's been a lot. And we could probably host 3 or 4 webinars, if not more, just on nursing care alone. But I wanted to say thank you and wanted to just acknowledge some of the repeat questions that we're getting about availability of this information down the line. Nicole, I think we have time for maybe one more question if you have one, and then we'll pivot into caregiver resources that Caregiver Action Network has.
All right. I guess a question that we can end on is, what options do you have when a place is discharging your loved one? So either an assisted living or a memory care facility to a nursing home.
What options do you have? Well, if I understand the question, if you first of all, you want to be very involved in that process. Okay, a lot of times what we see is people who are discharged too soon or discharged unsafely, right? And so you want to make sure that if they are being discharged, that they're not doing it in a haphazard manner, that they are making sure there's a continuity of care, that they are setting in place not only a safe transfer, but making sure that the resources are there that that your loved one is going to need, either if they're going home for more rehab care or hospice care, or if they're moving to another facility. Moving from a hospital to a rehab center or a skilled nursing facility is what we see the most. We see that most often, and depending on the facilities that are involved, some bad outcomes can come if you're not involved in that process. So you want to make sure that you know where they plan on sending them, right? You want to have a chance to go look at the facility. Like I said, tour the facility, make sure it's appropriate for them, and make sure that they can provide the appropriate levels of care and therapy that your loved one is going to need. If you have an issue with a discharge, there's usually an appeals process. Okay, and so you can discuss that with the social services department at the facility. There's usually a discharge planner who you will have contact with. And then if you think that the discharge is unsafe or that the discharge is inappropriate, then you can usually file an appeal, which will delay that discharge for a number of days. My experience is the appeals rarely, if ever, get granted. But it's certainly worth a shot and does buy you time to try to find a better facility or outcome for them.
Absolutely. Thank you, Nicole, for fielding those questions for us. If we have any of them left over or any questions from the chat, we will review them and try to provide the answers also on our webinar landing page where appropriate. But we hope that everybody has received the information, the absolute depth of information and understanding that Jeff has brought to this conversation. We appreciate you so much for being with us today. Next slide, please. So, Caregiver Action Network manages a number of caregiver resources, and these things are helpful whether you're looking into choosing a facility for your loved one or you're trying to still figure out how best to serve them in their current location and in their current capacities. We absolutely appreciate the audience and the connection and the trust that we've built up with caregivers. And we make these resources available free of charge for your use. You can share them. You can send out links to your family and friends and to your other provider contacts as needed. Next slide, please. So the first thing is our Caregiver Action Network Family Caregiver Toolbox. This is an online resource and tool that allows you to kind of work through various topics, various understandings that you will need to have to make your family caregiving journey a little bit more manageable, if not being able to decipher some joy out of what you've been called to do. To Jeff's point, nobody really asks for this, but a lot of family caregivers are pulled into this, not just by need, but also by emotion. We are hardwired to care for other people. So the Family Caregiver Toolbox puts all of these resources in one clear place to find online. And as you interact with our tools, we welcome feedback to let us know, how did it work for you? Was it easy to use, easy to understand? Because we're constantly seeking to perfect how we interact with our caregivers. Next slide. We also have the National Caregiver Help Desk. So this help desk can be reached at 855-227-3640. This help desk allows for us to field calls from caregivers, many of whom might be calling as they are experiencing not a 911 medical emergency, but just coming to a point of needing help, seeking resources, and wanting to feel supported in their caregiving journey. So we encourage caregivers who are looking to connect to community and to have clear guides to advocacy resources as well as local resources that they can access for their specific care situation. We invite you to call the National Caregiver Help Desk. And again, you can reach this via our website at caregiveraction.org or by phone. Just give us a call at 855-227-3640. This line is not 24 hours as of yet. We're working to build our capacity there, but you can always access us on the website, and it has a chat feature just in case being on the phone is not practical in the moment. You'll be able to do that. I see Nicole smiling. I remembered. Next slide, please. We also have our Take Care newsletter. This newsletter is meant for caregivers. It highlights not only some of the activity that we are monitoring, let's say in the landscape or in the marketplace, but it also highlights the work and the projects that we work on at Caregiver Action Network to help bring even more resources to caregivers. We are a disease agnostic organization, so we don't just focus on Alzheimer's or just focus on rare disease. We try and aim to present and create opportunities for caregivers across all manner of disease states and therapies to be able to experience support and recognition. My goal is to make sure that you feel seen and that you feel heard in your caregiver journey. So the Take Care newsletter is just a way for us to engage you monthly, and you are invited to sign up for the newsletter and become a part of our Take Care newsletter community. Next slide, please. We also invite you finally just to stay connected from our website to our caregiver help desk phone number. You also can email us at info at caregiveraction.org. That email is monitored. We do receive those emails, so we welcome your inquiries. anything you heard on the webinar today or just any general questions you might have, you are welcome to contact us. You can also find us across your social media at the handles listed on this slide. We are on Facebook, Instagram, LinkedIn. We are on Threads, TikTok, and YouTube. So if you're looking for webinar shorts, if you're looking for replays, if you're looking for just our in the moment thoughts about caregiver activities, movements, and policy, new and innovative programs, local, state, and national, we invite you to follow us or engage with us on your social media. At this time, I would like to give the floor back to Jeff in case he has any closing remarks for today's webinar.
Thank you, Amira. I just want to say thank you for being here and thank you so much for the work you do every day. It can end up being some of the most important work you do in your life. So I appreciate you and your family appreciates you.
Thank you. And I'd also like to hand the floor to Ms. Nicole Goebel for brief remarks as our Director of Community Initiatives.
Yes. As always, please feel free to reach out to caregiveractionnetwork.org if you have any follow-up questions or if you are looking for information connected to this topic or to this webinar. All of our resources are free of charge to family caregivers. So please know that you are always invited to come onto our website, peruse our caregiver toolbox, and any other resources that we have, share them with other family members, friends. I do also, I did see a question come in about the caregiver help desk, and can folks volunteer for the help desk? The answer to that is no, not at this point. We're really fortunate to be working with Carolo, and they are connecting folks with caregiving experts and advocates who come with a wealth of background, both in terms of social work, therapy, and so we really want to make sure that we're connecting caregivers to that level of support. But we will always keep folks in the loop if there are opportunities for caregivers to share. We know how important it is to connect with other caregivers. And certainly many of the folks that you'll reach at the help desk are fellow caregivers as well.
Thank you so much, Nicole. At this time, I would just like to thank our audience for joining us today and for receiving very well this information on how to select the right long-term care facility for your loved one. This concludes our three-part series on planning for care, which was a legal as well as financial engagement for caregivers. I appreciate your enthusiasm and your interest in all three topics, but especially for today. Thank you for your time. Have a wonderful afternoon.